Greetings, everyone. Welcome to another prep hour session. I can see people streaming in. Greetings to all. Hope this finds you well. It's just gone 5 p.m. where I am here in Brisbane on the east coast of Australia. It's October the 13th, and I can see people coming in. Hello to, whoa, lots of people there. Just type in your location and what time it is in your region. I can see everything's working now. I'll just stop my share. There you can see a bigger picture there. Let me just check where everyone is. Okay, where are you located and what time is it, everyone? Hello to Fiji. Hello to UK. And let me just check my Facebook chat, everyone. Just a sec. Just bringing up my Facebook chat here. Hello to Nepal. Hello to Zambia. Hello in Kerala. UAE is here. Hello to Saudi Arabia. So it's 10 a.m. Yes, it's a good time. 3 p.m. in the Philippines. Excellent. Hello to Pakistan and India and Turkey. Copenhagen. There's a new one. Hello to Copenhagen. So good morning, good evening, whatever time it is. I've just one little job I'm doing here at the moment, just getting my Facebook chat going so I can see all your comments. Just a sec. I've got the image, it's deciding not to give me the chat. There's my chat's going to come up now. Hello to Nepal. Hello to Zambia. All right, got it all functioning now. Bit rusty, haven't done this for a couple of months, everyone. All right, so I think I've got multiple channels open, everyone. That's what's going on my screen. So a little bit of juggling to make this work, but it is working. Okay, now something just stopped. Just type in if you can hear me, everyone. Looks like the Facebook just closed. Okay, now it's coming back. All right. Oh, that's the video. All right, I just saw the OET Center Facebook crash, everyone. If you're watching, just type in yes if you can see me and hear me clearly before we begin. So Jessica says she can, so I'm streaming on YouTube. All right. I'll just type something. I'll see if it gets reloaded, everyone. Just a sec. One last job to do, everyone. Okay. Let's get going. Interesting one for us today, everyone. I'm going to share my screen. I can't fix the OET Center Facebook one. Hopefully they come back on and join us. All right. So we're doing an interesting one today, everyone. We're doing a response to a patient complaint. All right, response to a patient complaint. Let me ask you all a question. What do have you experienced patient complaints before? And if you have, what do patients complain about? What do patients complain about? Just type that in for me. This is a response to a patient complaint. What things do patients complain to you about? I'm not talking about physical complaints, not about their health complaints. I'm talking about complaints perhaps in procedures or the way things are done. Do you have any experience on that? A lot, says Christine. A lot, yeah. Yes, they do complain about pain. Waiting. Yes, waiting time is a common complaint. Nobody likes to wait. Yes, nobody likes to wait. That's a problem. What else do people complain about? A lot of complaints. A long queue, that's right. All about the wait time. A delay, thank you, Mol, a delay in care. Abhishek says the food, the comfort, maybe they've got concerns. That's right. Okay, so that's what we're going to look at today, everyone. And we'll see how we go with that one. And just last thing to check. Okay. All right. The task we're doing today, everyone. First of all, don't forget, like us on Facebook, YouTube, and visit us at OET Online. That's our website there. We're going to do a radiography task, everyone. So it's radiography. Hello to any radiographers out there. Give us a shout out if you're a radiographer. But the skills we're going to learn today go across all professions because it's all about planning and organization. So we can see this poor health professional, 3 people lining up to complain. He looks like he's under the pump. He's under pressure. Let's see how he deals with this. So like any set of case notes, 5 minutes writing time, 40 minutes, 5 minutes reading, 40 minutes writing. Let's look at our case notes. But before we do, quick bit of vocabulary, everyone. This is some vocabulary. The OET Center writing tasks are great sources of vocabulary. I hope you use them that way. And always look up words that you don't know the meaning of, because that's going to help you for the next set of case notes you see. So in this case, we've got peripheral pulse, occlusive thrombosis, non-occlusive thrombosis, proximal, distal, and a protuberance. Can anyone tell me the meaning of any of these words? You just pick a word that you're not sure the meaning of. What's a peripheral pulse? Peripheral pulse. Maybe that's something you take yourself. A peripheral pulse. A peripheral pulse. I'm back on Facebook. That's good to know. Someone's fixed that. Thank you. Okay. Facebook. That's good to know. Okay. Hello, welcome back, Facebook. Glad you're here. Okay, just waiting for that answer, everyone. Pulse of extremities, says shut in. Well done, yes. The heartbeat of the peripheries, that's right. So a peripheral pulse, it's not a feeble pulse, no. It's a pulse which is palpable in the extremities, all right? Peripheral pulse, all right? On the periphery, on the outside. Then we've got an occlusive thrombosis. What's an occlusive thrombosis, everyone? Occlusive thrombosis. And glad you're with us, by the way, OET Center Facebook. Well done. Just waiting for the answers to come in. an occlusive thrombosis. Yes, it's occlusive means it's blocked. That's right, Abdul. Thank you. Something's blocked, isn't it? It's a thrombus blocking the circulation. So if that's what an occlusive thrombosis is, what's a non-occlusive thrombosis? Obviously, it would be the opposite, wouldn't it? A non-occlusive. That's going to be an incomplete occlusion, an incomplete blockage. What about proximal and distal? Proximal and distal. What does that relate to? It's a medical term, isn't it? But we've got a lot of normal mainstream language about proximity and distance relate to that. So proximal and distal. Lots of good answers coming through. Well done, everyone. Yep, away, says Jessica. Yeah, so proximal, we can say near the center or point of origin, and distal is away from the center or point of origin, near and away, that's it. So it's all about the origin, the proximal part of the bone or the vein, whatever you're referring to. And lastly, a protuberance. Now, we do have some protuberances in our body. Maybe the elbow is a protuberance. What's a protuberance? It's a funny word, isn't it? A protuberance. It's got 4 syllables, protuberance. Just wait for that one. A small mass, yeah, I suppose. Yeah, we're getting projected, thank you, Tinners, yes. Something that sticks out, isn't it? It's prominent, says Dr. J. Could be a bulge, some sort of growth, but it comes from the word protrude, something which sticks out. Now, reason why I'm going through this vocabulary, it's not super relevant to this task, but it's really nice for your reading part A, this sort of language. So remember, the good thing about OET, everything's connected. So a lot of what you do in the writing case notes, you can link over to your reading as well, especially reading part A. And if you think about the speaking part of OET, the role plays, that relates to listening part A. So I really like the fact that the OET exam, the parts of the OET exam are connected. That's always a good thing. Okay, let's look at our case, everyone. Now, I'm going to do a fair bit of talking here. So let's just go through it. So at the top, assume today's date is the 30th of August. Okay, that's today. We're going back in time, everyone. We've gone back in time 2 years. You are a radiographer in this case. Always read your notes. You are a radiographer working at the outpatient radiology department in Redtown Hospital. A complaint has arrived, oh dear, from Mrs. Penny Long, and she's a patient at your department, and it's regarding her wait time. Well, that's what you said before. People don't like waiting. Well, neither does Penny. According to Mrs. Long, her appointment was pushed back twice. Can you believe it? Twice in a single day, and then cancelled. All right, she's frustrated. So the head of radiography, perhaps your boss, Dr. Alan Jones, is asking for your explanation. All right, so you've got to explain this situation. Now, radiography tasks are a little bit unique. They don't have the usual medical history, everyone. But what they do have, it's the way it's structured. And you have to know OET structure. It's quite a nice structure, everyone. So if I look at the structure here, what I can see is we have document 1, which is here. Document 1, a radiology report, and that was the 9th of June. Then up here, I've got document 2. It's another report from the 29th of August. And then I've got document 3, which is an information log. So I've got to get all this information and somehow put this into a letter. I'm going to have to plan very carefully, everyone. So let's read through it, everyone. That'll give us an idea of what we're dealing with. So the name and address, we've got a date of birth. Now, provided patient history, uneventful until 2 weeks ago. That's 2 weeks before here. And then there was a left upper arm pain and swelling. She presented to ED, and she had a neurovascular examination and NAD, no abnormalities were detected. And the peripheral pulse, we saw that was normal. Reason for the procedure, possible thrombosis. And what was the procedure? Well, she had an ultrasound, a left duplex Doppler upper limb, and then there was an X-ray of the left humerus. That's what was done. And the findings were an occlusive deep vein thrombosis on the entire left brachial vein and the distal 2 centimeters of the axillary vein, the distal away from the start. Also extending into the proximal portion of the radial and ulnar veins. I'm sure that's very precise if you're a health professional. There was a small amount of remote non-occlusive thrombosis with proximal subclavian vein, measuring 2 centimeters in length. So you got all this excellent data. And number 2, a secondary finding, there was a bony protuberance, that sticky out bit in the lower distal 1/3 of her humerus. All right, very medical speak as we go through it. But that's document 1. But we're interested in, let me ask you a question. Are we interested in this content? Are we interested in this content? That's my question to you. We're writing about a complaint. Are we interested? While we're thinking about that answer, let's just look at document 2. Document 2 says, name, date of birth, provided patient history, same thing, bony abnormality found in the first X-ray and a repeat X-ray required. And then reason for procedure, same thing, possible bony abnormality found in first X-ray, procedure, repeat X-ray required of left humerus, and then findings, X-ray cancelled, patient pregnant. Let's keep going. Because remember the note says a complaint has arrived to your radiography department and Dr. Alan Jones is asking for your explanation. All right. Someone asked, is this for doctors? Says Chandra. This is a radiography task, everyone, but really good language. Okay, let's have a look at this information log. This is your medical world. Good to know. At 10:30, there was an X-ray for Mr. Mal Brown. He's 65. He had chest pain 1 week ago, no hospital admission. And he arrived early for an 11:30 exam. He complained of nausea. You offered for him to call the doctor, but patient refused. And so emergency, given priority over next patient, Mrs. Freeman. Uh-oh, there's a change in order. There's going to be a delay. He's come in for his 11:30 appointment early, and he's complained of nausea. So you prioritized him. Mrs. Freeman had to reschedule. So at 10:30, Mrs. Betty Freeman had an X-ray. She's 75, right humerus, and it was rescheduled to follow the chest X-ray. She offered to wait as she was not in a hurry. Oh, that was good. She's not stressed. because she could see Mr. Brown was quite sick. At 1100, Mrs. Penny Long had her appointment, and that was rescheduled to go after the right humerus procedure. Patient unhappy. There's your complaint, everyone. There it is. She's unhappy about having another x-ray. She felt sick and tired, poor thing. And all patients given option to return later. So you did come up with a solution, but Mrs. Long declined. She wanted to wait it out. Let's keep going, everyone, so we know this case. There's more notes, everyone, still on document 3. Lots to think about on this one. So at 1100, it'll all make sense in a minute. The chest x-ray of Mr. Brown, okay, it happened. All patients rescheduled, so it was done. Emergency CXR. At 11:30, Mrs. Long requested to see the radiographer read the long wait, and you explained the reason. But Mrs. Long asked to be seen before the next scheduled patient, Mrs. Freeman. She's trying to push in. Her request was denied. Explained, that means you explained. Mrs. Freeman is elderly, the poor dear. She's been waiting over 1 hour. We can't give her priority. At 1200, X-ray for Mrs. Betty Freeman, 75, of the right humerus to rule out plaster cast. And it was very slow. She needed a great deal of assistance getting ready and the dressing. And one view had to be repeated due to patient movement. The patient was moving around. As a radiographer, you couldn't get a clear shot. So that was slow. So at 1300 hours, finally, Miss Penny Long is going to undergo her procedure. A question for you. How long has she been waiting, everyone? Let's see who's been paying attention. Mrs. Penny Long, 1300 hours. What time was her initial procedure? If anyone remembers, type it in. So anyway, this will help you. Winifred says, my problem is how to pick important information. Coming up, Winifred, we're going to pick it out. Mrs. Long complained about the long wait. She was very annoyed and said, Mrs. Freeman should have been seen after her. Re-explained is what you did. Patient was not satisfied. Then you did a verbal check if pregnant. 4 weeks gestation. You discussed the risks. 2 pluses means they were moderate. The x-ray was cancelled. Patient unhappy. And you referred the patient to the doctor. Oh my goodness, what a long day for Mrs. Penny Long. And at 1330, there was another procedure which is not relevant. Using the information in the case notes, write a letter to Dr. Jones, head of radiography, giving an explanation of the events that led to Mrs. Long's delay, rescheduling, and cancellation. Wow, that's what you've got to do. All right, would you like to get a task like this on exam day, everyone? Linda says she was waiting over an hour. Yep, 10:30, says Abdullah. Actually, if we go back, we can actually see it was 1100 when it was scheduled. So she had how long did she have to wait? About 2 hours. Now, someone mentioned, how do I select information? Well, you have to respond to the task question. So for this particular one, we're not really interested in document 1 so much, because that's the details, that's the medical details. But this, Dr. Jones wants to know, why was Mrs. Long's procedure delayed? And it wasn't for her own medical reason. Okay, let me show you how you organize this. So this is what happened, everyone. Have a think about this. Patient showed up for x-ray at 11 o'clock. That's number 1. 2, the procedure was delayed because there was the emergency needs of another patient. Now, that's my question to you. Does that happen often? Are patients often forced to delay due to emergency needs of another patient? I'm sure your answer is yes. It's just a fact of life. People have to deal with it. They may not be happy, as is Mrs. Long. But that's what happened. All subsequent procedures delayed, not just Mrs. Long's, but all of them, right? All of them were delayed. Mrs. Long wants to be seen before another patient. Should we let her? Debatable, unless she has a good reason. Perhaps not, because the other patient was elderly. So that request was refused. Sorry, Mrs. Long, just have to wait. She could come back tomorrow. And then finally she was seen, but cancelled because she discovered she was pregnant. So can you imagine? It's all the things that could happen happened on this day. All right, like a perfect storm. Okay, let's write our introduction, everyone. How do you write a response to a patient complaint? So I'm going to show you, everyone. So we put everything here, and you're going to help me with the vocabulary, everyone, with the vocabulary. All the same as you always write your letters. Dr. Alan Jones, Head of Radiography, Redtown Hospital. We've got an address. Date, 30th of August, 2019. So that's all just copy and paste, everyone. Dear Dr. Jones, now the re is interesting, everyone. For this one, we're not going to put a name or a date of birth. We're going to use a different subject, and I'm going to see if you can tell me the subject. Re. Now, if we got this, her appointment was pushed back twice in a single day. Have a think about that, everyone. What is your reason for writing? That's what you summarize, re something. What happened? There was an X-ray, a procedure, it was cancelled. Who wants to have a go at summarizing that in a formal way? Any radiographers? If you're a radiographer, oh, B's a radiographer. Is that right, B? Any radiographers here? Type in me if you're a radiographer. Her appointment was pushed back twice in a single day. So it was a type of, it was pushed back. I'm just going to wait and see who can come up with a word. Whoa, Christine is onto it. A procedure cancellation. Beautiful work, Christine. Excellent. Yes. Explanation regarding a cancelled X-ray. Quite good, Abdullah. Yes. Anyone else? I'll show you what I've got. I know there'll be more coming in. Procedural delay for Penny Long. That's it. Procedural delay. Reschedule procedure possible. Yep. But it was a procedural delay for Penny Long. Okay. Now, I am writing. Help me out here, everyone. The head of radiography, your boss, Dr. Alan Jones, he asked for your explanation. So what would you put here, everyone? I am writing. He's asking for your explanation. Ask for your explanation. So you are, it's two-way, everyone. Think about this. He's asking for your explanation. So that's that way. And you're going back the other way. That's what this letter is. Think about the title. Letter of response. So I am writing what? Who knows? Come on, Facebook people, get in there and type as well. I am writing Waiting for it. In response, thank you, Christine. That's it. I'm writing in response to your request, not in reply to your explanation, Shadin, because you're giving the explanation. It's in because he asked for. So synonym for ask for is request. So I'm writing in response to your request for an explanation regarding why we were not able to. What couldn't you do? The procedure was then cancelled. Why we were not able to. Very good waste of time. That's a good name you've got. For an explanation regarding why we were not able to. Mrs. Long's left humerus X-ray as scheduled. What couldn't you do as scheduled? There was something you couldn't do. You were not able to do. Different answers coming through. I'm going to check something else while I'm waiting. What couldn't you do? Perform. Thank you. Thank you, Prasima. Prasamsha. Yep. Regarding why we were not able to complete, but perform, both proceed with, Christine, would be very good. Continue. You could use conduct. Yep. As scheduled. And the last bit, 29th August. Well, the easy one, today's the 30th. So we're going to use yesterday. Yesterday. Now, we've used some good synonyms there. What I want to tell you, if you're watching this video, all introductions are the same in the sense that you've got to get your context right. When I say context, I mean who, what, when, where, and why. Get all that information in, and you'll get quite good marks for purpose because you will have summarized the situation. Okay, let's move on. Okay, now the initial cause of the delay. We read all this information before, everyone. So this is the document 3 information log. So we'll work through this, everyone. Mrs. Long's X-ray was booked in at 1100. That's what happened, right? Now we've got something at 10:30 hours. We needed to perform an urgent CXR chest X-ray for Mr. Malbrown, who something nausea and refused to see a doctor. As a result, the something appointments had to be something. All right, how are we going to connect this, everyone? Mrs. Long's X-ray was booked at 1100 hours. Now we've got a contrast. You couldn't do it. However, at 10:30 hours, we needed to perform an urgent chest X-ray for Mr. Malbrown, who, now I want you to give me a synonym. Let's try our synonyms, everyone. It says here, complained of, right? But what other words could we use instead of complain of? Patient complained of something. There's other words we could use, everyone. A lot of people got however, well done. Now, who, what would you put here? He complained of nausea, but I want to use a synonym. It's the same word that we can use for pain as well. Developed, good. You could say yes. Who had developed nausea. Oh, nice, Lavena. Who was experiencing nausea? Excellent. Who felt nausea? Nice, Rama. Yep. Suffered from nausea? I'd say, you could say who was suffering from. Yes, because obviously you are suffering, if that's the case. So who was experiencing nausea? So nice paraphrasing. And refused to see a doctor, which he did. As a result, now here's a key word. I want you to get this word, everyone. It's a very useful word in OET when you're doing your timeline. So we got 2 appointments. He's coming at 10:30. Then we got Betty's appointment, and then we got Penny's appointment. So 2 appointments. What's a word, a timeline word, that describes the order that things happen? A type of appointment. The something appointments had to be something. Can you figure it out? Answers coming in, the few options. Prior, well, they weren't prior, Dr. Hemant. They were, because they were going to go ahead. Scheduled would work, Christine. Yep. Lavina's got it right. The subsequent appointments. Now, I really say to you, try this word. It's a wonderful word, subsequently, because whenever you're talking about case notes, no matter what your profession, you've got to describe the order of events. So really work on this word. Subsequent events had to be, and then we've got reschedule. We've just borrowed that word. Okay, that's the initial cause of the delay. And what this writer's been able to do, just organize one section of case notes describing what happened. Step 1, gone right to the beginning. What caused the delay? Well, Mr. Brown was experienced nausea. He was nauseous and he had to be prioritized. Okay, next one. Further issues. So there were further issues. Now, this is the part where Mrs. Long wanted to be seen ahead of the other patient. So let's see how we summarize this, everyone. Mrs. Long was keen to be seen. Mrs. Long was keen to be seen. Okay, what are we going to do? But we were unable to, something you couldn't do. She was keen to be seen before next scheduled patient. Request denied. Early, no, that could work. Was keen to be seen early. Any other things? By the radiographer, well, she was. But we're talking about the relationship with Betty Freeman. Urgently, that works, Dr. J. Yes. Let's have a look. Earlier, that's right. She was keen to be seen, in this case, a little bit like urgently, or immediately, good, as soon as possible, but we were unable to. What couldn't you do? We were unable to. Her appointment, as we had another, maybe schedule, prioritize. There's a good carry out, Idris, good. But we were unable to prioritize her appointment as we had another Mrs. Betty Freeman. How can we describe? Accommodate is good, Georgian, yeah. Accommodate her appointment. Excellent. We were unable to prioritize her appointment as we had another. How can we describe Mrs. Freeman? She's 75 years old. Push through. Good, Reggie Mark. Yep. Okay, I'm going to bring this one up. We had another elderly patient. Mrs. Betty Freeman, who, now I want you to help me with the grammar. This one, what we have to do, we got here, over an hour, who, and we got a comma here, Mrs. Betty Freeman, who, tell me what's the 1 hour. So the OET exam, you've got to expand on the case notes, right? So for this one, you're going to say, who, you're going to have to do 1, 2, 3, 4, 5, about 7 words here. Georgian's onto it. Past perfect, everyone. Who had been waiting? Yes, Javert. Who had already been waiting? Cherry says who has been waiting. No, we must use past perfect to describe a period of time before a past event. Who waited for almost an hour? Good. Who waited for more than an hour? I think it's more than. Who was waiting? You could use was. Had been is better though. Everyone's getting it. Well done. Who had been waiting over 1 hour, right? And now we've got a comma. So we had Mrs. Betty Freeman. Now this is extra information. That's why we've got 2 commas. Who had been waiting for over an hour, booked in for a right humerus x-ray before her. This something took 1 hour to complete. It says that very slow. Needed a great deal of assistance. Getting ready and dressed. One view repeated due to patient movement. All right, just have a look at that one, everyone. I'm going to see if I can see if we're appearing on another Facebook page while I'm waiting for your response. No joy there. Yes, thank you, Christine, Jessica, yes, Linda, yes, lots of people know that one. This procedure, the use of this is good. This procedure, the right humerus x-ray, took 1 hour to complete as the patient required assistance as she was unable to something. Now, I want to show you negatives, everyone. How to use inversion is quite a good strategy. It says here, patient movement. One view repeated, there was patient movement, right? Because she's restless and you're trying to take an x-ray, but she's moving, so you can't do it. So we can do an inversion. What couldn't she do? We know she's moving a lot. That means the opposite, she couldn't. What's the opposite of move in this case? She was not able to. All right, you've got to use an opposite here, everyone. Oh, nice, Ashish. Not stay still. Good, EE. Not stay still. Yep. Cooperate. That's good, Rhoda. Yep. And you all know this from your workplace experience. That's the beauty of OET. Stay still. Yep. Control her movement. Yes, that's good, Halamia. All right. So I've got here lots of great ones. Thank you. Lots of options coming through. And she was not able to remain still during the x-ray. That's what she couldn't do. Now, this is a useful strategy, everyone. Think about your inversions here. All right, so we've used it quite a lot of our own language. We've expanded on the case notes and we've described these further issues. Let's continue. Okay, reason for the cancellation. Let's see what happened next. As I said, this was a crazy day for the radiography department and for Penny Long. So Miss Penny Long, she's 31. Mrs. Long complained of a long wait. She was very annoyed. Okay, let's see what happened. Finally, at 1300 hours, finally, we saw Mrs. Long, who was, now I've got a hard one for you, very annoyed. Can you give me a synonym for very annoyed? Finally, at 1300, we saw Mrs. Long, who was, how would you describe her? She was what? Upset. Yep, she was upset. Now I want to check your vocabulary. We're going to use upset, all right? But I'm going to put another word before it. See if you can work it out. You got to. This is a tricky one. She was upset. What's the expression? You could see she was upset with your own eyes. It was obvious. I'll see you can get this word. It begins with V. This is a vocabulary test. She was upset. Maybe not bored. She would have been bored. Not really disappointed. She was angry. Yes, disturbed, a bit harsh. See, you can get this word V. I. It's a hard one. Oh, Georgie, you're very close. Use an adverb. Obviously, yes. Vindicated. Well, I don't think she's going to get vindicated, Reggie Mark, but good try. We're nearly there. Kristen, you got it. Well done. I knew someone would get it. She was visibly upset. She was shouting. You could imagine, yeah. She was visibly upset. It was visual. So that's a good expression. She was visibly upset at the something. Long wait. Give me a synonym for long wait, everyone. She was visibly upset at the long wait. We need a synonym. Which was beyond our control. You couldn't control that. You had a priority patient. A verbal recheck that Mrs. Long, vivacious, is Dinah. It's a good word, very good word, Dinah. Hasn't quite described her annoyed thing. All right. Mrs. Long, who was visibly upset at the something which was beyond our control. Waiting time, that would work. Georgian, good. Long, not really a cue. Prolonged wait. Beautiful language, Juveria. Long term, probably not. Delay, pretty nice and direct. The delay. It's not really a cue. Can't really say neglect. Well, waste of time, says Winifred. Well, I'm sure she felt that. She felt that, yes. Not really a word we'd use. Okay, a verbal check revealed that Mrs. Long, okay, synonym for 4 weeks gestation. 4 weeks gestation. A verbal check revealed that Mrs. Long, I'm sure you know this one, 4 weeks gestation. That was the response. A verbal check revealed that Mrs. Long how are we going to describe that? Is pregnant, yep. And we don't know 100% sure, Lavina, so we just change it to could be pregnant, it's a possibility. Is expecting, that's quite good. She could be pregnant. So we discussed the risks of X-ray exposure, and that was moderate. And I'll help you here. The procedure was cancelled. Done. Mrs. Long was, I'll finish this off, was then referred to her GP. That's what happened. We've just expanded on the case notes, everyone. X-ray cancelled, procedure was cancelled. Then is a nice sentence, everyone. Little hint, never start a sentence with then, but we can use then in the middle of a sentence. Mrs. Long was then transferred to her GP. Okay, and the conclusion. So remember, this is a response to a complaint. Using the information in the case notes, write a letter to Dr. Jones, giving the explanation. Okay. Of the events, there were many events which led to Mrs. Long's delay. She's got the right name, Mrs. Long. I hope this, now here's an interesting word, everyone. We've got the word explain. This is a hard one. I want to test your vocabulary again, everyone. I hope this something light. It's an explanation. The light's covered, then you uncover the light so everything is clear. Give me a synonym for that word. I hope this on to the events of the day. Information, yep. Suffices, not nice try, Javeria, but not quite. Cascade sounds like maybe Spanish. I'm not quite sure. It doesn't quite work. Clears up the situation. You're getting close. Oh, Aaron, nice word. Enlighten. Yeah. Justify. Clears. We could say clears up. Highlights. Okay, bit of a hard one. I'm going to see who can get this one like we did before. Brings light. That's the closest we've had. Prithvi, well done. S. 4-letter word. But it's going to be 5 letters. Something light. It means brings light. Yep. 2nd letter, H. Who's going to get it first? It's like the same meaning as providing light. Yep. 2 more letters. Ends in an S. Ooh, Javer, I can see who's got good vocabulary. Excellent if you know this one. Sheds light. There it is. So we shed light. Good word. Well done. Who knows this idiom? Well done if you know this. I hope this sheds light onto the events of the day. If you require further clarification, do not hesitate to contact me. Yours sincerely, radiographer. And we're done. We've written our letter. Let's have a look at it, everyone. Shines light is also a good one. This shines light, you could use shines light. Okay. And there's our letter, everyone. And I just want to show you, think about organization here. So we've got our letter here. It's all neatly laid out. And what I did this time, just to make it clear for you, someone mentioned at the beginning, think about, and this is the same for all, but this is the reason for writing and the contextual details in the introduction. And then it's just about organizing your paragraph. And make sure yourself, when you get your case notes on exam day, no matter what your profession is, good planning is the key. Allow 5 to 10 minutes to think about the way you're going to organize information. There is a tendency to sometimes just follow the order of the case notes, but that's not really what this task, that's not necessarily the best way. You really need to look at information and how it's connected and draw lines on your paper, connect the dots, and really look at grouping information in a subject-based manner, right? Which can include, you might write a paragraph on past medical history or social history, a paragraph on the progression while in hospital. You might write a paragraph on the subjective history over several visits, or another paragraph on assessment and findings. If you get used to planning and looking at sample model letters of how they're organized, that will be very good for you. So this one had second paragraph, the initial cause of delay was expressed. Then the further issues were grouped together. Finally, why the procedure was cancelled. And then your concluding note. So think about that when you write. You should be able to, and do this yourself, when you've written a letter, try putting a title to your paragraph. If you can put a title to your paragraph, that means it's well organized. If you can't put a title to your paragraph, why then? There's something, it's maybe a little bit disorganized. So you should be able to title your paragraphs, and that will help with your focus. Of course, don't title them on exam day. Just do this as self-practice. Okay, Happiness Karubo says, do I need to write my name in between sincerely and radiographer? It's optional, everyone, optional. Either or, don't have to. All right, I'm just going to clear this. I'm just going to tell you a couple more things, but we are done, everyone. It's a little bit eventful. We did lose OET Center Facebook. Sorry, guys, you couldn't join us, but still had a good crowd on YouTube and our Facebook page. Excellent. So if you're a radiographer, we can help you. Look at, this is Virginia. She was a radiographer. She studied with us and achieved her dreams. But of course, we help nurses, we help doctors, we help all professions. I want to make an announcement, breaking news. So we do a lot of work with the OET Center to ensure that we can look after all the needs of all health professionals. And this one here, just to let you know, we are fully endorsed for radiography, as we are for medicine, for nursing, and so forth. So if you're a radiographer, this one's for you. I like to help those in need. So radiographers, hasn't been a lot of content out there, so there's a good one for you. Lavina, thanks for your feedback. And look, you failed 5 times. I don't like to hear people not succeeding so many times, you know. Sometimes I think, rather than just self-study, because the exam's expensive, do yourself a favor, jump on board and do a proper course. Look, we're always accepting students at OET Online. We run live classes, 2 per day in great time slots, Monday to Friday. Don't forget, Mondays we do grammar, that's your foundation. Tuesdays is reading, plus an allied profession only class where we cover dentistry, radiography, vet science, pharmacy, and so on. Wednesdays we do speaking. Thursdays we've got our 2 listening classes, no repeats. And Friday we have a nurse only class and a doctor's only class. So really nice way to progress so that you don't have to take the exam so many times. If you're interested, everyone, check it out here. I'll just drop it in. You can come to the website and just create a free account, costs nothing, and you can do our free trial course and find out what it's all about. So that's what's happening there. And if you do want more information, email us at info@oetonline.net.au and just visit us at oetonline.net.au. Thank you everyone for coming today. I hope you enjoyed this session. I'll be back again in another month or so. I think we're going to look at speaking, everyone. We'll see how we go. Thanks, everyone, for coming. Bye for now.